This has been a debatable topic for decades, and in some cases proven to be positive for individuals with terminal diseases. But what are the effects if it's being abused? This brings up another subject called Cannabis Use Disorder, and to tell us more about it is Nurse Christina Paris from the VA. Good morning, Christina.
Hi, good morning.
Thank you so much for joining us this morning. And just to jump right in, what exactly is cannabis use disorder?
So cannabis use disorder is an addiction that can come from heavily using marijuana or cannabis. Now, similarly to alcoholism, we have functional alcoholics, meaning that they're able to drink alcohol and still maintain careers, family life, and enjoy hobbies. So when we're talking about heavy cannabis use, sometimes it can cause people to the inability actually to follow through with normal everyday tasks, work, family, and hobbies. In fact, the potency of cannabis use has gone up from 3% to 20% over the past 2 decades. So not only was breaking up easy to do in the 90s, but apparently THC content was lower too.
Wow, that's so interesting. And I mean, we hear about marijuana use as a treatment for cancer. So what are some of the effects on the body and brain?
So you're correct. We do, there are a lot of good medicinal uses for cannabis. However, there's a lot of negative side effects too. So we look at 1 in 11 people can become addicted. When we're talking about teens, it's even higher, 1 in 6. And that's because we have these THC binding receptors in our brain. They're very dense. And those are the receptors that are involved in learning, memory, reward, motivation, and control. So when we have those receptors binding to marijuana, then you become addicted. You want more of it. Your body's craving it. But it has a lot of bad effects like anxiety and increasing your fight or flight, which increases hormone production and heart rate, and you're not able to actually relax.
Wow, that's really interesting. So tell us some of the risk factors that could attribute to cannabis use disorder.
So if you're noticing that your teen or young adults, and it can even go into adulthood, but probably less common, are having poor negative school experiences. They're unable to maintain employment, steady employment. People who are who earn less than $20,000 a year annually can be at risk. People who are unmarried, divorced, or separated. Having legal problems, like an adult who's on parole, probation, they're actually 3 times more likely to abuse cannabis. And having people who don't have really good positive social relationships with their family or spiritual connections, those people are at higher risk as well. And then also they notice that people in the West Coast, it's more prevalent, probably because it's legal in some of those and in urban areas too.
Wow, so if somebody finds themselves in this situation or having this disorder, are there other treatment options besides substance abuse treatment centers?
So there's cognitive behavioral, which are psychotherapy approaches, motivational enhancement therapy, and some even can use CBT or MET, but really your goals are to enhance motivation and reduce cannabis use. You want to improve people's social skills. You want to improve their social support, manage painful feelings, and then educate people more about the consequences of heavy cannabis use. But really quitting and abstinence is really the only main treatment that will work.
Wow, well, that is so interesting. So thank you so much, Nurse Christina, for joining us this morning and giving us those facts.
Absolutely.